very excited. I think this is probably the person that I'm going to talk to so far since we started to have conversations that I'm most excited to talk to. And the coolest thing is he's probably the youngest. So that's a testament to his track record and accomplishment. It's really, really impressive.
Thank you.
And I've worked with some very impressive guys. I've worked with some of the most impressive guys in healthcare. And just getting to know you now, you're way up there. And it's a little intimidating, actually.
Oh no, please.
So
come on.
you should be very, very proud. Right? And we've only spoken for a few minutes before we kind of started the conversation officially, and you have great energy, very humble. So I'm very much looking forward to this conversation. I actually think with Dr. Jared Dashevsky, there's probably 6 different conversations I could have. What I'd like to do is just kind of tee up some topics, go back and forth, and have much more of a conversation than anything. But I do have some questions because I want to pick kind of a brilliant mind on some of the topics that I toil with. It's rare that I have somebody who's a doctor, who's in the business of healthcare, and who's curious about how to change it, right? So most of the time, if I know a lot of doctors, and they're doctoring, which means doing what they did yesterday, today, and then tomorrow. And that's fine. And then the folks that want to disrupt things tend to be from the West Coast, Silicon Valley, came from Amazon or Google, have never been in healthcare. And so they're interesting to talk to, but when they're telling me all their ideas, I'm like, that's not going to work. That's not going to work. That's not going to work. And so, your blend, I think is very, very unique, one I can relate to. And so I really couldn't be more excited to talk about it. Also, you're a Jersey guy, as am I. I know I want to start with you're a health system engineer. I want to know, I've never heard of those words put together. Maybe that's my ignorance or your uniqueness. You're also a physician and you're in the midst of residency. Before we get into more tactical topics, can you just talk about your fascinating journey and what led you to where you are, and then kind of the newsletter and the megaphone you have and kind of your trials and tribulations?
Sure. So I went to Lehigh University. I guess this is where it all began, in Bethlehem, Pennsylvania. And I knew since high school, I knew I wanted to be a physician. I didn't know the path I would have to take to get there. Of course, everyone knows, medical school, MCATs, gotta do what you gotta do. But at Lehigh, I was doing well in school academically, and they had something called this presidential scholarship where they would pay for a master's, full ride, and you could choose whatever master's degree you want, and you could stay. And so I was going through the plethora of master programs at Lehigh, and I really wanted to position myself well, to be competitive to get into medical school, but also to position myself well, after residency and when I'm a doctor. And, I studied psychology as undergrad. I'm do I want to do psychology masters? It's probably not going to help me, right? If I'm good at master in psychology, I might as well get a PhD in psychology. And my wife's getting a PhD in psychology, so that could be her little field. I was anthropology, that would be cool. That's unique. Then I came across healthcare systems engineering, and I'm well, Lehigh is very well known for being an engineering school. And I looked more into it. I talked with the program director, and I'm this is amazing because I could go into medical school with a psychology background where I understand people, how they think, but I could also go into medical school with an engineering background where I learn about systems engineering, concepts, methodology, and how to apply it to fix healthcare. And so I applied, got in, and started in 2018, literally a week after I graduated. And I guess I'm kind of like a nerd. I was so excited to to do more learning and not face real life yet, where I had to make a salary. And in this
that was a year, 2 years?
That was 1 year.
Okay.
1 year straight.
At Lehigh.
At Lehigh.
I don't think I've ever met anybody who did that degree.
Yeah, it's becoming more popular. I think Johns Hopkins.
So give me what do you, on a Tuesday afternoon? What's the midterm? Is this comp sci or what?
Yeah, so I'll tell you. So I basically went into the program very naive about U.S. healthcare. I was very fortunate growing up that I could access healthcare whenever I wanted. I never had to really wait. I was pretty healthy, and so this program was a slap in the face. You're wrong. Boy, do we have a story for you. And so essentially this program was U.S. healthcare focused, where you learn about the system, like informatics, the history of U.S. healthcare. But you're also sitting in engineering classes with like PhD students who are doing engineering, master students who are doing engineering. And the engineering classes consisted of like game theory, simulation modeling, optimization. We're like blending together calculus. And listen, these classes were very hard.
Yeah.
I had literally no engineering background, but I would just like take it all in. And throughout the program, it wasn't so much like really learning how to solve this optimization problem. It was more teaching you like the thought processes of like, how should you approach like financial models or like business models, right? You're always trying to maximize something, minimize something. You have a certain amount of constraints. Like that was the mindset that I learned, all while learning about healthcare. And so during this program, you got to elect to do like a capstone project. And my buddy and I, who was doing like a technical entrepreneurship master's, decided to tackle the issue of like wait list, right? So if you want to get an appointment with a dermatologist, it could take like 3 months, right?
Yeah.
But we found this like great paper which analyzed like lead times to get into with a physician. And there's actually this theory called like the lead time paradox, where the longer you wait to get into the doctor. So if I schedule today for a doctor's appointment in March, I'm actually more likely to cancel that appointment than if I had the appointment in like January.
Mm-hmm.
And so we were like, okay, so dermatologists, a lot of independent practices are just keeping this like handwritten wait list of people. But at the same time, like people are canceling every day. And what does the front desk do? Like they go through the wait list. Hello. Oh, no, voicemail. Hello.
Yeah.
And now the doctors are just losing revenue through these open spots. So we prototyped this solution, which worked, where we were able to have like a wait list of patients. And as soon as the office told our software that there was an opening, it automatically went through patients. And whoever said yes would fill the slot and the office would be notified.
That's great.
And so it was really cool to be building this while also learning about healthcare and also learning about engineering. And, we failed a lot. We had a lot of successes. We had to do like interviewing with stakeholders, and we had a lot of like, what the hell are you doing? This is stupid. And it was great. Like this 1 year truly changed my trajectory. Unfortunately, I couldn't keep up with it going into medical school because the resounding feedback was like, this is great, but you're going to need to integrate into the EHRs. No one wants another standalone platform. Okay, how do we do that? Well, you need Epic and you need to get software engineers, and it's going to cost millions of dollars. And I'm like, I just don't have time right now to raise millions. So that whole year was jam-packed, a lot of learning. And like that basically set me up for what I now do in medical school, or did in medical school and residency. And like that was kind of like the impetus to Healthcare Huddle.
Yeah. And so that's awesome. That's very unique. I've never heard anybody who went through, I don't think I know anybody who had that degree. And just listening for the first time about it, it immediately makes all the sense in the world why you then went on to do what you do. And, deconstructing complicated problems, none are more complicated than healthcare.
Mm-hmm.
And back to the setup of the convo, I think everybody and their mother agrees that healthcare is broken and everybody thinks they can solve it. Why don't you just ... And I think this is a little cliche, and I don't like it when doctors say this. I think it's a defense mechanism by us, but it doesn't make it untrue, which is it's much more complicated than you think. And I hate excuses and I hate scapegoats, but it's true. And so I think that kind of like the way you described kind of that year of how to think about complex problems, engineering or de-engineering or what have you, makes a lot of sense. And so can you now talk, I'm really interested about how then, okay, you did that. That's pretty unique. And that, by the way, gives me some insight into your personality, that you kind of take a left turn. And I think you took a couple more left turns. And, Healthcare Huddle, and you decided, okay, I'm going to go to med school. You're going to med school. And then kind of, this awesome newsletter that you started, kind of the journey in building that.
Yeah. So I guess I will loop this back into the program. I had this professor who like worked in corporate healthcare, old school, came in every class with like a bunch of articles from like MedPage Today, Med City News, and he would be like, did anyone see what's going on with the ACA? Or did anyone see what's going on with Amazon? Because Amazon at the time was like banding together with like JP Morgan to start Haven. Yeah. And it was very
In Berkshire.
Berkshire, yeah.
Atulagawande was
Yeah, exactly. And every class, like he would just come into the news and he was so well read.
Yeah.
And he inspired me to just start like reading the news.
Yeah.
And really, because you could tell, even if you read like one article a day, you can tell who's doing the reading and who's not.
For sure.
So anyway, get to medical school and I'm jacked up. I'm like, I want to talk to people about digital health, insurance, all the issues in healthcare. Because Mount Sinai is a very, very bright medical school. Like all my friends were Harvard, Brown, Dartmouth. Like I was the stupidest one there.
Right.
No one heard of Lehigh University.
Yeah.
But no one could talk to me about insurance, about healthcare, about digital health. And my view at the time, and still is, it's like we all want to be the best physician, which means we need to know how to take care of patients at the bedside. But I don't know about you. I see a patient in the outpatient setting for 15 minutes. All right. So what happens what happens outside of from the bed, like far from the bedside?
Yeah.
And what happens far from the bedside is insurance affects patients, Medicaid coverage affects patients, access to cheap generic medications affect patients, right? So if you don't know what's going on in the industry, you can't really take like 100% full care of your patients. So that was the impetus to like figure out, why don't my colleagues know what's going on? And between classes, I would like interview them, because again, in the master's program, I learned about like design thinking methodology, that you really need to interview your stakeholders. You don't know the solution, your customers know the solution.
Right.
So I would interview them. Why don't you know about insurance? Why do you know about digital health? I have no time. And insurance, like I don't know anything about insurance. Okay, so not enough time. You don't know. It's too complex. I can't understand like a health affairs article. All right, it's like all these things just like coalesce together, and I'm like, all right. I knew of Morning Brew, which was this like business newsletter. I'm just going to create the Morning Brew for healthcare, see what happens. So almost 5 years ago to date, I think December 22nd, I like sent this like Morning Brew-esque email on healthcare to like 5 of my friends. I used MailChimp, and like so poorly designed, but I wrote about the ACA, I wrote about Fitbit, and I wrote about something with obesity. And I sent down, like, this is great. Like if you could do this, like I would read it every week. And so then next week, I sent it to more of my colleagues. I'm like, oh, this is great. This is great. And I started iterating on like what content they liked, how to design the newsletter. And then now like 100 of my colleagues are now signed up and giving me feedback. And then in mid-January, I reached out to my brother, Brett, who was at College Park, Maryland at the time, studying business. And he always had like a very design savvy mindset. I'm like, hey, can you like start making Instagram posts for me? Can you design this newsletter? And so he took like action and like redesigned this newsletter, made it look very professional to the point where if you looked at it, you'd be like, oh, they've been around for like years.
Yeah.
And so that increased some like brand like trust. Went back, continued to go to class, continued iterating. My friend Harrison, who went to MIT, like took me out to lunch. I don't know what he was like scouting out. He's like, let me build all your tech. And I'm like, dude, this just started, but okay.
Yeah.
Like, so people are like proving to me like there's something here.
Sure. Yeah.
So he ended up building the whole website. My brother would literally like do like sketches of what he wants the website to look like. Harrison would like put into action. He would build all the tech behind it. And then COVID hit. And all of a sudden you have all these people who like need a source of information, but they didn't really want it from CNN, Fox. They wanted it from someone like on the inside. And technically I was a medical student. Like I was on the inside. Mount Sinai was the hardest hit hospital in New York City. So like I just started getting organic growth. More people started reaching out to me. Hey, can I join your team? It's just 3 of us. But I'm like, sure, listen, I'm going to see what you got. Maybe you could help write some content, or at least like find content for me to write about. I will now like start thinking about how to make this into some sort of business, and like think about growth and think about like strategy. And then it's like over the years, we started building a team, making like a very small amount of revenue, but like for someone in medical school making like any money, I was like, this is awesome. Like, what can this turn into? And it's like by 2021, we were like running a newsletter every week. We had like a college ambassador program where we recruited college students from all over the United States because they had nothing better to do during COVID. Like they weren't partying at school. and they're interested in healthcare. They joined this program. I said, you refer people to Healthcare Huddle, I will give you like free lessons on healthcare. I will give you apparel. I'll give you mugs, stickers, whatever. And they ate that up. We grew again, built more trust, launched like an education community where I had experts like in healthcare write content. Like tell me what copays are.
Yeah.
Tell me what private equity is. Tell me what like premiums are. And it was so exciting. And, you know, all during the first 2 years of medical school, it was great. I was virtual, so I could like be in class learning about like COPD and like right after like pivot to Healthcare Huddle. So that was everything up until like summer, fall of 2021. And I'll pause there to see if any comments, because then like it gets even crazier.
No, that's pretty incredible. Like you're creating this kinetic energy. And you're right, like you're getting feedback loops from across, like whether it's stakeholders or people who are, you know, wanting to find some kind of purpose or mission. But no, I want to hear more. Just tell me what goes next.
Yeah. So like I'm going to continue referring to this matches program, and they're going to see this and be like, oh, I'm going to repost it. But it truly, I learned so much. And one of the things I learned that my buddy and I joke about was when we were building this waitlist platform, we talked about like iterating. Like we need to iterate, right? Like get quick feedback, implement the next version, get feedback, and keep implementing. So that's what we did with Healthcare Huddle. So then going into my third year of medical school, where you're actually in the hospital, things started to get like reality started hitting in.
Sure.
Like, oh, I want to be a doctor. I have a duty to take care of patients now and like be in the hospital from like 7 a.m. to 8 p.m. or 6 a.m., like whatever it may be. But I also have Healthcare Huddle, which now has a huge following, but also a very loyal following. I need to make content. I need to manage a team. I need to figure out business, like how are we going to make money? And so I spoke with my co-founders, so my brother Brett and Harrison, who was a medical student, and we're like, guys, what do we do? Because Harrison was also a third-year medical student. And we had a conversation, and we said, someone needs to stop what they're doing and figure out how to raise money and do this full time. I wanted to be a doctor. I was fully committed. I'm like, I'm not dropping out. Harrison's like, well, if you're not dropping out, I'm not dropping out. My brother Brett had a job lined up at Capital One, comfy, like, oh, like that's where you want to be after college. He's like, I'm not dropping out. I just started.
Sure.
So we were basically like, what are we going to do? And like, at that moment, this media company called Workweek was just starting, and basically you could think of them like a record label where they acquire the artists and they will take care of all of like the marketing, the sales, the partnerships, you name it. And they approached us and asked like, hey, like we see what you're doing. Like we really like what you're doing, and we want you to join our company where you, Jared, will be like the sole writer, the face of Healthcare Huddle. Because at the time I wasn't the face. I had a bunch of other people helping out. But you will be the face of Healthcare Huddle, and we will take care of the business aspect, the marketing aspect, and all you have to do is write. I'm like, huh. So I could go to medical school, you know, do my clinical duties, and just write content. And so it was actually a very difficult decision, because we were thinking like, what is the best thing for Healthcare Huddle? And if we stop producing content, like people would notice. So that's why we said like, we need to move forward this, because we don't want people like noticing that Healthcare Huddle died. Like what a disappointment. So we kept going with Workweek, and I think we went through with the acquisition at the time in November of 2021. And so my brother ended up quitting his job at Capital One.
Oh,
eventually, right?
Okay.
Working for Workweek full time. Harrison like phased out. And so it was just me creating content, pumping away. And it was very fun. They really helped with growth. They really helped build like relationships with partners. Made money during medical school, which is great. Again, like a medical student making money, like what more can you ask? And all the time, like I was with my high school sweetheart, like we ended up getting married. So like, it was like perfect.
Awesome.
And then I started Residency, which is like, I guess, phase 3 of Healthcare Huddle, where intern years, very tough.
Sure.
You're in the hospital 24/7, working night shift. And I just couldn't keep up with like the demands that, I guess Workweek wanted. And so like
Which were your content-based, basically.
Content-based. And so we just mutually agreed to like part ways.
Okay.
So I took Healthcare Huddle back. They continued to, they're exist today and they're doing very well.
But it was back to you. They had nothing to do with it.
They just gave it back to me, like very respectfully, like mutual splitting up. And this was November of 2023, so last year at this time.
Okay.
And I had to do like a lot of reflection, like what I want to do with Healthcare Huddle. Like I want to be a doctor. Like, being in the hospital, I love the pace. I want to do pulmonary critical care. Like, I love treating patients. I develop such rapport with them. And it's just very, very gratifying to care for patients. But I also love Healthcare Huddle and making content and the business side of it. So I took like a deep reflection and tried to figure out what I wanted out of Healthcare Huddle, what I had the capacity of doing. And basically I decided to like launch a new subscription model for Healthcare Huddle where I would now have people pay for premium insider content, right? Because now I'm actually like on the front lines. I'm seeing how digital health can actually impact patients. I'm seeing what happens with expensive medications. Like the amount of patients who message me, doc, I can't afford this Coreg, or I can't afford this asthma medication. Like that's real stuff. And it all had to do with the content I wrote. So I launched this Huddle Plus membership, which gave huddlers, which I call my audience, access to premium content. Started launching some courses, and so that was like in March of 2024. Now we're December of 2024, and I have like 100 paying subscribers, and I charge like $24.99 per month, or like around $250 per year. And like, this is great, like not passive, I'm working, but it's great income for me on the side of Healthcare Huddle.
You're still producing free content.
I'm still producing free content every Sunday.
And that has like thousands of people that are
30,000 people.
Right. And then a segment of them can then opt in for this, which is more interactive learning.
I try to make it way more personal. It's way more educational in the sense that, for example, I send a Thursday newsletter called Inefficiency Insights, where I take this engineering background, identify an inefficiency that I've seen firsthand or that I've read about, and I really like do a root cause analysis. I describe the problem, talk about like the impact that it has on patients, physicians, health systems, and then I provide solutions. Right. And if you were in healthcare, whether you're a consultant, a physician, an administrator, an executive, like this is like insight you kind of want. Like what are physicians seeing on the front lines? What are solutions that we can enact? Oh, they already did a root cause analysis. Like, this is great. And then once a month I publish a trends newsletter, which is way more in depth than a typical Sunday newsletter I write, which identifies like a key theme in healthcare. Let's see, 2 months ago it was like hospital at home. A couple months ago, it was like retail health, private equity in healthcare. And these are like juicy deep dives or juicy analyses into
all
these
written
topics.
content.
All written.
Yeah.
Only recently have I tried to move into the video space within my community. But yeah, all written, all thought pieces. And I'm making revenue, which is great. Not like a ton, but like enough to like basically have like a second income while doing residency. And it's nice. I've built great relationships with my audience, have connected with brilliant people, you being one of them. Like, I wouldn't be here if it weren't for Healthcare Huddle. And there's a lot I want to do with Healthcare Huddle. But foremost, like the mission is to really simplify the complexities of healthcare for people who don't have time to read up on it and give them the knowledge they need to make changes. It doesn't need to be huge changes. It could just literally be at the physician-patient level, and that's all you need.
I mean, there's a couple of things, Jared. Like, so I think for the second part of our conversation, if it works for you, I want to like go into healthcare stuff.
Sure.
Okay. Like I said, I'm very curious. Like, it's rare to, like I said, to have this perpendicularity of like, background, IQ, curiosity, blah, blah, blah. Very rare, right? I mean, I'm obsessed with healthcare, devoted my life to it. And I'm particularly focused on the parts of it that don't work well, meaning all of it, and problem solving for being unaccepting. And so I want to see what cool ideas we can put together.
Sure.
Before I get to some of those topics, I want to like sit a little bit on that journey, because one thing I've learned, like as I kind of go through life and like meet like the smartest, most curious, and frankly, most impactful people, it's rare that they don't have a unique journey. Like, it's actually rare that you have someone with what I'll call, for lack of a better term, a linear journey.
Yeah.
Who then has a disruptive impact. It's not impossible. Like, you'll find the guy who like went to like, Harvard undergrad, Harvard med school, traditional background, and then decided to flip the table upside down. But I generally don't find that too often. I find folks who did a bunch of like zigzagging, that was kind of because, like a dog sniffing around, they're just looking for that next thing. They're curious. And then they end up having a huge impact like you did or like you are. And so there's a couple of parts that, of your story that I want to like ask just questions about. One is, doctors generally are thought to be risk averse. Okay. And you have a psychology background. I've hired hundreds of doctors. I've managed thousands of doctors, and there's definitely like anything. I'm sure I'm some guy who worked with lawyers would say the same thing, but I work with doctors, and there's definitely a physician mindset, right? And there's a conservatism that's an underpinning because first, do no harm. And that I think actually attracts that type of personality, which is first, check everything. Don't, look 10 times, measure 5 times before you cut. And that's important as a doctor, right? You don't want your doctor being callous or cavalier generally. You don't want them experimenting on you. You want your doctor to do what's tried and true. Whereas in a business mindset, you want the guy who says, everybody's doing left, let me go right. Heterodoxy is applauded. And as a doctor, it's quite the contrary. Fundamentally, we need to do what's been done a million times and we know works. And so that mindset attracts a certain personality type, which is almost diametrically opposed to taking risk and kind of bucking the trend. Can you talk a little bit about, because your story is full of bucking the trend. Can you talk a little bit about, is it something that I learned it from my dad, or is it something that was always innate? Or were there moments like you're trying to be efficient in your narrative, but were there moments where you're like, no, dude, this was like, I was scared shitless to do this, but I decided I want to do it because I would be unhappy to it. Was it really thought out, or it's just who you are?
That's a good question. I'm definitely very strategic, and I vividly remember. I think I even wrote it in like, not my diary, but like I had a journal in college, and for like the healthcare systems engineering, I sat down and I wrote out like, what are all the possibilities? What would be the advantage of doing healthcare systems engineering, taking a year off, delaying my career a year to get this unique background? And one of the things I reasoned out was like, okay, your story, like all about telling your story when you apply to medical school will be, you have the psychology degree, you understand how humans think, which is very important when it comes to patient care. And then you have this engineering degree where now you understand like what goes on at the system level and how to like problem solve. And like this, and then I'm gonna have an actual medical degree. So now when I come out of medical school, like that's kind of like a hot commodity. Like you want someone with psychology, engineering, now medicine, like that person's gonna do something. Kind of like you said, like something's gonna happen.
Yeah.
Hopefully for the better. But that was definitely strategic. I don't know where I developed that. I mean, it must come from my parents who very supportive, like do what you want, we're here. I also think they were very happy that I was going to be a doctor. Like I told them I was going to be a doctor, and they're like, all right, that's a stable career.
Sure.
And if you want to take a couple risks along the way, that's fine.
Sure.
And so that's what happened. Growing up, I played a lot of sports. I ended up finished my adolescent career doing cross country and track. Which is very much like strategy driven, right? Like you need to do a certain amount of training to get a certain amount of miles under your belt. I found it very cognitive, and you put in the work now and it pays off down the line when it comes to race day. And that's definitely a mindset I have. It's like put in the work now, trust the process. And then when it comes time for game day, like you're ready and you're prepared. So I definitely am very strategic. But when I got Healthcare Huddle back, I spent like maybe a week planning out what I wanted this premium membership to look like. And then I just launched it. That was the risk I took. I'm like, I launched it at a more expensive price, launched it, saw who would subscribe, realized after a couple months, like wasn't getting enough traction, lowered the price, more traction. And that goes back to like iterating, which I'm very comfortable doing in like the business sense.
2 more questions before we get into like healthcare. Sure. Because this is so fascinating to me. I just love it. 1, looking back at the last 5 years that you've been kind of, give or take 5 years on the healthcare huddle journey, which of course mirrors your medical journey. what would you have done differently? What was, because you're daring and you're audacious, which is why you've been successful, but there's always little prices to pay for that. What was it? I gave up healthcare huddle when I shouldn't. No, I took it back when I shouldn't. What is it?
No, that's a good question. You know, I'm not sure if this is hindsight 2020, but by focusing on healthcare huddle throughout medical school, that was very non-traditional. Like all my buddies were doing research
Yeah.
and publishing papers.
Yeah.
I remember having a lot of cognitive dissonance going throughout medical school, and I maybe published one paper, but it was a quality improvement project, which is part of my story. Like I want to improve the system. But to be honest, I hated research. I think healthcare huddle gave me the mindset to say no to things that are not going to add to my story or bring me value. And I learned how to say no. And that really like made me more comfortable with sticking to this path. But along the way, there was a lot of like cognitive dissonance. I'm not sure if like doing research would have like put me in a different residency program or not. Sinai is very innovative and they really support like the innovative or the doctorpreneur. So I'm thankful that I'm there. I really don't think I would have done anything differently. Again, like I really planned it out and I take full responsibility of every step that I took. Yeah, I'm right now I'm very content. That's all I'll say.
And then the last question, and then we can move on. Balance in your journey, like it sounds to me like the pivotal junctures, like that first one, and of course I'm like ashamed to even start judging it, but you get where I'm coming from. The first one is where you were like a year or two in, and you had Harrison and your brother, and you got approached just as you guys were kind of getting the wind in your back. You got approached by Workweek, and you're like, well, they're gonna strip out and do the stuff that we don't want to do or can't, and whatever. And so that's like a pivotal juncture. And part of that calculus was balance time. Like, okay, now I'm going to med school, whatever.
Yeah.
And then again, taking it back and internship. I think something, and this is maybe a little philosophical, but most people who are listening or watch, or that I know or that you know, most people in life are not content. Meaning they find pieces of content throughout their day or their existence. They love their dog, but they hate their job. But you seem to be wholly content. And I think that a lot of that comes from balance. And people have different definitions of balance. You exercise and eat. That's important, but it's, I don't want to say superfluous, but I think it's limited. Balance in terms of your becoming, whatever you become, takes certain calculus along the way. And the irony, and this is why I hate the terms like work-life balance, is actually there's moments, and moments might be months and years, of extremeness that you might have to take to achieve the balance that leads to content. It might be extreme sacrifice. It might be extreme work hours. It might, whatever. And you did different calculus that led you to where you are, where you're content now. And I can feel it. I can sense that you're content. And I think your work shows that. And by work, I don't just mean healthcare huddle, although that's a masterpiece. I mean your work as a physician and maybe a husband and so on and so forth. That's something I toil with, like, because I have extreme traits, but actually I feel very balanced in many ways. To the normal person, I'm very imbalanced, but like, because, I work 7 days a week and, I'm obsessed with this, and I'm averse to vacation, and I get, but to me, waking up at 3 a.m. with an idea and then, texting Mo at 4:45 a.m. and say, get this person, whatever, is totally normal. Like, I don't know how else it could work. Can you talk about how because anybody who listens to your journey is like, this guy's nuts. Like, med school is crazy. But you did med school and then you launched like one of the most popular and frankly most like respected by healthcare guys. It's one of the most it's where people go for information. Can you like, are you deliberate about balance? Are you like, yeah, because you said you're strategic. Can you talk a little bit, almost give advice for people who are, I want to do this, but you know what? I have a mortgage to pay, or I want to do this, but I can't find the time. Can you talk a little bit about how you find and create balance?
Yeah, no, I mean, I feel like I'm talking to my father. My father-in-law is very philosophical. He's an ICU doctor. Like,
Okay.
very stoic, but I feel like I'm talking to him. I wouldn't. So my whole balance journey, it didn't come easy. I was very disciplined growing up. Again, I did sports. I think that had a huge impact on how I structured my days and thought about things. I tend to get very, 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 very excited with new ideas, as you probably do too, where I will text my buddy who I started that first company with. Like we chat every Sunday just to share ideas because we're just filled with them. Maybe we don't execute any of them, but it's cool to talk about, and so that really drives me. But my balance journey wasn't easy. During those first 2 years of medical school, I was kind of like all work, no play. I loved it. Like, I guess I'm blessed that I like work. It's very fun to me to be productive. But it reached a point where I'm like, I should talk to someone. Like if someone who's trained.
You said the wife is in psychology?
My wife is PhD.
Okay, psychology.
She may have helped me. I realized. And so I ended up talking to someone and really was very insightful, helping me work through what my understanding of what being productive is. Because there will be days where, I can't watch a movie. That's not productive. How's that benefiting me? That's not productive.
Yeah.
If I'm watching TV, I'm not doing healthcare huddle. I'm not studying for my step 1 exam.
Yeah.
So it's not good.
Yeah.
It's I spent months working through it with him to the point where no, watching TV with your wife, that's productive. You two are bonding over a shared activity.
Yeah.
And that's beneficial. And so through this changing of my understanding of productivity, it actually made me more content.
Yep.
Knowing that I can be productive with work, but I can also be productive with growing a family, doing activities that way. And that has since seeped into residency, where again I talked about saying no, where I say no. My first response to anyone asking me to do something, unless you're a family or friend, is no. I won't tell them that, but I need to think about it before figuring out
100% my motto.
Yeah.
Yeah.
Because if I say yes to everything, and that was me before, people are gonna pull you aside and pull you one way.
Yeah.
And what ends up happening, not to get deep, but your family ends up being the ones bearing the burden of you saying yes to everyone else.
Yeah.
Because then you definitely take them for granted and be oh, they're always going to be there.
Yeah.
While you're doing all these other things, and it takes a toll when you're not seeing them. So again, saying no has been very helpful throughout residency. It also helps. Actually, I make money now because I say no to so many people that if I say yes, I'm only saying yes and charging a consulting fee.
Yeah.
And then so now I'm being productive, but I'm also now making money for my family to pay for childcare.
Yeah.
So if I had to give advice to the audience watching this, is to really understand your journey and what you value, and any side project, any interview, anything that doesn't align or support that hustle, I would just say no to it, because it's just not going to benefit you and it's just going to stress you out.
I mean, I can't tell you how much I love that.
Yeah.
All I talk about with the team is it's no until proven otherwise.
And I
we
that.
get all these inbounds and whatever. You talk about consulting. We were approached by folks to take what we're doing now at Baker Health and the brand, blah, 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 and attach it to a very prominent consulting firm and be the tip of the spear for their healthcare.
Oh, interesting.
And go into the 3-person ENT practice that didn't sell out, but doesn't know what to do with waiting. What you were talking about was exactly the kind of stuff that we would want to be, or they have crappy online reviews. They don't know why. And okay. And help them. And we were close to, we were going to do it. And then because we're doing something else, we're no, we have to, the other term, the no leads to narrow your focus, right? And so everything you said couldn't have resonated more. And then the funny thing, last thing, and then we'll go on, is I told you it's gonna be 10 conversations. So the wife family thing. So I've been married for 15 years. I've been married, right? And I got 2 older kids, and my wife, we'll go to dinner with the wives and we'll get into it. But I met my wife in undergrad. We didn't see her for 10 years after graduating. We ended up getting married just very serendipitous, right? And she's an attorney, but 10 times like smarter and more capable. And then she ended up in the previous company we were building. She ended up like doing some like legal work for us, and then ended up being the chief administrative officer. And we worked together ever since. And she works for me, so we work together. And so a lot of times I'm like, dude, we don't have to go on vacation. I see you like in the office, like, that kind of thing. And so when I took that year off, we spent a lot of time together. Okay. And then when I was like, listen, I'm going to do this new thing, me and my, and then I was like, this is going to be intense. I'm going to do technology. I don't know anything about technology. I have to learn while I do it. I'm going to do hospitality. I don't know anything about I interviewed all these Four Seasons guys, but you have to actionize it. Oh, and by the way, we're going to do healthcare too, And I said, I know, we know how this is going to go. I said, give me 3 years, no vacation. And this will make me happy. Okay. And anytime I'm not working on the business, I promise I'll be with you and the kids, but don't tell me to go away for 5 days, because I know what we need to do. And I know how focused I have to be on it. And she agreed. So
Until she didn't.
last week, out of nowhere, I see that there's 3 or 4 days in December where I'm no meetings, my clinical hours are gone, coverage is happening, and I'm like, what the hell is this? And she reminded me, she's like, it's been 1,000 days. No way. It's been 1,000 days. We haven't done a family, whatever. It's 7 days a week for 3 years that you've been doing this, and time's up now. And so at the end of December, we're going to Aruba or something.
Right, that's holding you accountable.
Yeah. So, and the good thing is though, honestly, after this, we go upstairs and we have a business meeting. We have business meeting 4 nights a week. But one of the compromises my wife made when we moved here was okay, all the meetings happen at the house after work. You're not stuck at the office. And so, the kids are in half the meetings. They're sitting there tonight we have a digital media thing. So they'll be there and be like, Dad, that YouTube stuff sucks that you got to do. So
Feed Bob it for
that's the content balance thing. And you just kind of find its journey as long. So anyway, I can't tell you how much I can relate to all this stuff you're talking about. And I think you figured it out way ahead of when I did. So that's great.
Can I add one more thing before?
Yeah, by all.
Yeah, of course. So you talk about focus. I think that, again, to come to saying no, I read that biography on Steve Jobs, and it was
Isaacson?
Isaacson. But the key theme that I took away from it is just this: Steve Jobs had such an insane focus, and his ability to just look at what he wants, and he just got it done. And so now, I took that mindset. Oh, he was an asshole at the end of the day. But I took that mindset and really applied it to my own workings for core focus, even stuff that I want to do with Healthcare Huddle. I really can only afford to do one thing at a time. And, that needs its core focus.
That's great. I mean, I think you got to figure it out. I think the first time I came across your work, somebody, I don't want to say the wrong thing. I think my old CFO had presented, he's like, hey, look at this thing. And it was about, we used to do journals for administrators, journal club for, journal club in Medicine's Common. We did it for our administrators too, because we wanted to educate our administrators on healthcare. And, and I think, I don't know if it was the Medicare donut. And I remember you did a piece on something like Medicare donut. And I was like, guys, here's the most simple way to think about it. You deconstructed it in a very apt way, right? Because it's the type of thing you could read about PBM. I'll read 10 PBM articles and end up more confused than I did the first time. So actually, it's not a matter of just finding content or finding experts. It's very much finding the right content. And that's the beauty of Healthcare Huddle. It's back to your, healthcare system. And it's deconstructed and simplified in a way. And I always say the greatest genius is simplicity, right? And so let's start there. Pharma. So I saw more recently, you did a really nice piece on what Mark Cuban's doing.
Yeah.
And so can you kind of, for the viewers and listeners, talk a little bit about people underestimate how big a part of the healthcare business and economic problem pharmaceuticals are, because people are like, well, doctors make a lot of money, they're part of the problem. Insurance companies suck, they're a problem, and they're like, well, drugs are just drugs. I think because there's no face attached to it, people underestimate how disproportionate impact they have. Can you, with your deep dive and expertise, talk a little bit about how you see pharma and you've examined it, the problems, and dare I ask, like, any potential solutions?
Yeah. So, I don't get paid by pharma in any way, but I respect them for drug discovery and, creating drugs that save lives. But the drug supply chain is it's just a mess. And
Break it down.
okay, so let's see. We start with like the drug manufacturer who makes the drug. So Pfizer is a drug manufacturer. They make the drugs. A wholesaler will buy, like, I don't know, I forget if they make Lipitor or some statin. Wholesaler will buy the statin at bulk, and then the wholesaler will like send it to the pharmacy, and then the pharmacy gives it to the patient. And then money is involved. So the money goes from the patient to the pharmacy, but the patient's also paying premiums. So it goes to the insurance company. And then you have this guy in the middle called a pharmacy benefit manager who is basically in charge of getting drugs on insurance plans formulary. So Pfizer made the statin. Pfizer wants this statin on United Healthcare's whatever plan formulary. So they say to PBM Healthcare Huddle,
Optumrx.
Optumrx, it's like, all right, we will give you 5% of the list price of this drug if you get it on your formulary. And so that's how the PBM makes money off the list price.
Yeah, legal kickback
Yeah, then
in the form of a rebate.
And then the PBM will also give money back to the insurance company, and the insurance company theoretically gives some of that money back to the patient, which I don't know if happens. But no one really knows how this money is moving back and forth, how much is moving back and forth. It's very opaque. And because it's opaque, and we know that PBMs are getting a percentage of the list price of the drug, that kind of incentivizes these drug manufacturers to jack up the list price. Because they PBM, that's how they make the money. So there's a percentage of that drug. And so, you don't need me to tell you that like drug prices have just ballooned in America, making well-needed drugs unaffordable for Americans. Meanwhile, you have other advanced nations who pay like a quarter of the price that we're paying. And the question is like, why do they get away scot-free? And then, it always comes back down to, well, we're funding the research and development. Sure, it's true. I think there's been plethora of studies showing that's not the case.
No.
And so Mark Cuban, who's a wonderful entrepreneur, comes out of the woodworks and says, like, at this system, right? Like there's legislation going on, trying to tackle PBMs, trying to tackle drug prices. Nothing has worked. And I can tell you why it hasn't worked. It's because the people with the most money are the people who are lobbying the best to prevent things from happening. And so Mark Cuban was like, I'm just going to create this this company that sells generic drugs, completely transparent. There would be like a 15% markup fee, a filling fee, and like a shipping fee, and that is it. And we have 4,000 generic medications. So if you wanted to buy your Lipitor or your atorvastatin, and it typically costs you had like a $40 copay for like every month that you refilled it. Well, you can get a 90-day supply for $5 or $10. And the way it works is Cost Plus Drugs basically says no more middleman. You just go from wholesaler. I think True Pill is the one who manages all their pharmaceuticals, but you go from like True Pill straight to the pharmacy, straight to the patient.
Yeah.
There's no insurance.
Do you think it's going to work?
I think it is working. And now they're tapping into like the B2B side.
Yeah.
Right. So first they were direct to consumer, really marketing word of mouth to consumer. And I'll be honest, I still don't think physicians know about cost. Like, even though I'm writing about it, I don't think many people know that they could prescribe these generic medications as a cheaper alternative than what their insurance plans offer. And I think it's been working with the consumer end, and now they're doing the business end, where they just had a partnership with UPenn, and they're like, you bulk buy from us, like the 11 most frequently used drugs that you guys use, and like we'll stock them for you. So now, like, if there's a drug shortage, like you already have the drugs and you bought it from us at like a transparent price.
Yeah.
And the hope is that Penn saves money down the line from this, and they keep using Cost Plus Drugs. And
I think they have free health systems right now. I can imagine them expanding. My hope or wish is that they form some sort of partnership with CMS, the Centers of Medicare and Medicaid Services, to basically get cheap generic medications to Medicare beneficiaries.
Yeah. I think like that's a great breakdown. I mean, it's words like cartel have been used. And it's a pretty kind of intricate flow. And I don't think that's non-deliberate. And you used a polite word by saying it's opaque. And these are, incidental characteristics of the system. And, it's a nice segue into the next topic I want to talk to you about, because you have this PBM stuff that's been going on for a couple of decades. And it's been driving drug prices up as more Americans are on more drugs than ever before, and as healthcare costs are rising. And so there's a tipping point. And even with what you see, what's happened in the news, like the tragedy that happened in the news, it's like this boiling point of frustration. You have this constellation of things. You have an all-time kind of frustration with healthcare system cost, accessibility, and stuff. And then you have these outsiders like Mark Cuban coming in, trying to disrupt things. And I think you hit on something that people from the outside of those things from the outside of healthcare, you see on CNN that like the CEO of United gets, and because of how frustrated people are, you see Mark Cuban's on Shark Tank. People are seeing that. I think you hit on kind of the third leg of the stool, which is most healthcare is delivered by employers or funded by now outside the government, put the government on the side for a second. But the two biggest funders, even though we as individuals complain about the cost of healthcare, we're only responsible for about a quarter of the spend. A big part of it is employers. And then the biggest part is the government. And employers are into making profits. And government has a crazy debt that it needs to solve. And now when you have large private employers decide, because they're self-insured, right? And so they actually look at the cost in a way that maybe even the individual sometimes doesn't. And they have the transparency. They have brokers who can tell them, this is your pharmacy spend, this is your hospital spend. And they're like, well, there's an option. Your pharmacy spend is responsible for 23% of your total healthcare spend. Your healthcare spend is going up 12% a year. Your profits are only going up 3%. And we have a solution that could cut your pharmacy spend in half. They're going to say, yeah, at that point, but they're a little less beholden to some of the macro infrastructure. And so that kind of has to coalesce. And like you said, that then might end up being like the spark that lights things. And then you're seeing like Walgreens is, on the block. CVS Aetna is in a tailspin. And that's a lot of the verticalization that happened between PBMs and healthcare delivery and insurance. So maybe I'm being optimistic. I think I'm pretty reasonable. I don't think I'm that naive about it. But I think like what Mark Cuban is doing now with Penn and is with this backdrop is pretty unique, and it could set kind of things on fire, and maybe we'll see a downturn.
I mean, I can only hope. I wrote a piece a couple of months ago called like the Lindy effect or Lindy's law, which basically says like the longer a structure or system or process is in place, the harder it is to get rid of it. And I think for the longest time we've had this drug supply chain model that's very opaque. People just run with the flow. We complain, but we're like, okay, we tolerate it. And then again, with drug pricing going up and up, patients can't afford their insulin. Like, come on, like insulin. And that people are like, we've had enough, but like no one has been brave enough or has had the funding to cut it, to come in and be like, I'll handle this.
Right.
So, Mark Cuban's kind of like the face. I don't want to call him like Robin, but he's like the face. He's like, I don't care what systems are already in place. We're going to do this a new way, in a transparent way, because that is the main issue.
Yeah.
And so, I don't like using the term disruptor. I think it's overused, but like, I think this is actual disruption, where you're taking a business model that's been there for years and you're literally turning it on its head, and literally doing the opposite thing of what people have been doing this whole time.
And related to that, I think one thing that's happening that's coming out is the government funds, I think over 50 cents out of every dollar that's spent in healthcare, directly or indirectly. And so we like to think that we're in a purely privatized healthcare ecosystem in the United States. we are and we're not, that's a 20-hour lecture. But just for the purpose of this question, if we understand that healthcare is largely funded and subsidized by the government and taxpayer dollars, and we have a massive debt, it's also business as usual typically with government officials, because they're in and out and they're not interested in disrupting anything. And they've been lobbied by, all these players. And what's happening now, the backdrop to what we just said, this boiling point is, and I'm the least political guy in the world, but you have a new administration coming in that really doesn't give a shit. That's like, you can think what you want, but it's pretty clear they don't. And then when you look at their healthcare appointees, some of whom I don't like and some who I think maybe have a chance at doing something. But again, putting that aside, there are definitely unorthodox healthcare appointees, whether it's RFK Jr., Dr. Oz. These are guys that only would have been appointed now and have a direct edict to change things, right? And Bhattacharya, I mean, you go down the list of all the people that have been appointed in healthcare and health-related institutions. They're all folks who are there clearly to change things. And so you have, folks like Mark Cuban, business folks that are coming in saying, hey, this can be done better, cheaper, and so on. And now you have the main player in healthcare, which is the government, who is like rolling up its sleeves and saying, yeah, things are not right. We want to change this. Can you talk a little bit about, and you can be as political or not political, I don't care about that, but a little bit about what you see now over the next 4 years. Non-healthcare is this Doge thing, but you have these folks who are coming in to shake things up in healthcare. What's your early take on that?
Yeah. So again, kind of going back to like cost of drugs, like Mark Cuban said, I've had enough. I'll come in and I'll shake things up because no one else is. And I think the reason why so many people are on board with the incoming administration is because they're like the rule breakers, technically. Like the way we've been doing things in healthcare are unsustainable. We have the worst health outcomes compared to other peer nations. We spend so much money on healthcare. Like someone needs to come in and rattle things up. And I think, RFK, Dr. Oz, everyone who's been nominated are well fit to shake things up. I'm a little bit more hopeful for like the people with medical backgrounds who like have treated patients before and see what happens, and they have some public health backgrounds. And I'm also a firm believer, like I'll believe it when I see it. It's like, all of them have big talks, but like I want to see execution, right? If Dr. Oz and other folks are talking about increasing physician reimbursement through CMS, like let us see it, because for the past decades, like
cut after cut.
Yeah. It's like what is going to make me believe that you have all the power in the world to now like increase reimbursement? Where does the money come from? Are taxes going to increase? Because people won't like that. So, I think it's kind of exciting to see what happens.
Yeah.
Because I think everyone is fed up with the way healthcare is, especially with the recent events with the United Healthcare, that like, let's see what can be done with the new administration.
Yeah, I think I share. It's like cautious optimism, right?
I love that word. Yeah.
And I'm willing to suspend my political, like if I don't, to see, because I don't think it could get worse. And I think what we need is like to start from, it sucks, we got to change it, right? So I think at least that's a starting point. And then you've been really gracious with your time. I have like one or two more topics.
Sure.
And then we definitely need to like have another conversation down the line. But I also read more than one piece of yours that covers, and you mentioned, private equity, venture capital. There's also what's happening, you have the government, you have, entrepreneurs, but you also have had, and increasingly so, look, healthcare is a huge business. It's actually the biggest business in America. And it's growing. People are living longer and they're sicker than ever. And so that's bad for people like, at least I think it's bad for us as doctors, but it's big business. And, venture capitalist finance folks, private equity have been in and continue to be very much enthralled in healthcare. Nowadays, I have family members that are in venture and investing. And one of the guys said something fascinating to me. He said, Z, when I started, almost no funds, if a fund invested in a healthcare company, it was like, what? Why aren't you investing in like, oil or gas or tech or whatever? He said, now if you go to like tech funds, if you go to any investment fund, every fund has a ton of healthcare in it. Okay. And so what's your view? I know you've written on this and you've thought about it. What's your view on the entry into healthcare with private equity and venture capital, right?
Yeah.
And I know you've also written specifically on, things that have happened with like Village MD and stuff like that. But can you give me, because I know you've analyzed it scrupulously.
Yeah, I guess big picture. The way I like to analyze this stuff is like to take the physician lens and take the systems business end. And I think you said it, like you said, healthcare is the biggest business, blah, blah, blah. I think straight up when you say healthcare is a business, and at the end of the day, there are big stakeholders who need to make money. They have a duty to shareholders or other investors. And they're going to find ways to make sure that happens. And one of the ways is for, PE firms to, gobble up physician practices, because physicians are struggling with affording tech, with competing with health systems who are also gobbling up physician practices. So, I think we can have a whole other chat if PE is good, PE is bad. But I think if you understand that healthcare at the end of the day is a business, and, I treat patients agnostic to the business aspect of it, but it is a business. Once you understand where the money flows, like things start to make a lot of sense, and you can be frustrated with the way the system is, but it's difficult not to be you can't really be mad because, this is just the system, but frustrating, sure. So I think there is a role for VC to like fund digital health. Like, yes, let's fund the digital health company that's using AI to make a better EHR or to connect better with patients through wearables. Let's do that. PE firms who truly have some sort of, genuine desire to, consolidate physician practices, but to really improve economies of scale, which questionable if they actually happen in healthcare. That's great. But of course, there's bad actors, right? Like Huddle Hospital in Philadelphia was acquired by a PE firm, literally turned around and sold to another real estate firm within a year. And, people who relied on Huddle Hospital as like a safety net now like had to turn elsewhere. Where do they go? Jefferson, Penn, Temple. Do they have the capacity to care for thousands of more patients? Or their EDs are overflowing?
Yeah, and
So,
Stewart in Massachusetts.
Stewart in Massachusetts. Yeah. I even have, it's funny, I've physicians who are subscribed to Healthcare Huddle with Stewart emails, and every email now that I send, it gets rejected because they had to pivot to another company. Yeah. So I guess big takeaway, the way I view everything that goes on is like, you have the patient side of things. Like if patient care is affected at all, it is bad, right? At the end of the day, it's about the patients. And there is some role for VC, private equity. You hope that they do good, but there, of course, are bad actors.
I think that's great. I think, that's a good place to close, because really where we started, like what you've done with Healthcare Huddle is a good way to arm doctors and healthcare stakeholders with all this information.
Of course.
When you said, recognizing that healthcare is a business, I think recognizing that healthcare is complicated, and fortunately or unfortunately, doctors needing to recognize that if they want to be effective doctors today, they have to understand the healthcare ecosystem and what's happening. Because if you're unaware of the pharma game, the generics, the substitutes, then you're going to write something that either can potentially get your patient broke or will be denied because it's not on formulary. So being the old school academic doctor in a white coat with their head down who can quote the books is not only not enough, it's actually incomplete. It's incomplete care, like it or not. A lack of awareness on the PBMs, a lack of awareness when you send referrals. In the old days, my dad's a doctor. He never had to question if that cardiologist takes my patient's insurance. He never had to wonder accessibility, because accessibility has a clinical cost if they can't get in, right? And so now, unfortunately, knowing the books, knowing the biology and, the biochemistry is necessary but insufficient if you actually want to take good care of your patients. Because what's debilitating our patients is personal bankruptcy, is inadequate access to high quality doctors. And so now we have to know that. That's our formulary. And so what I love what you're doing is there's a lot of really good med schools, but there's not a lot of good
resources that can educate doctors and others in healthcare on this complex maze. And so very, very honored to have sat down with you. I learned a lot. I hope the folks that listen learned a lot, and I hope we could do this again.